Hi, and welcome to the presentation on measuring the impact of employment on persons with a disability as a means to improving the quality of employment outcomes. So I'd like to start by paying respects to elders past, present and emerging as we celebrate their stories, the culture and traditions of Aboriginal and Torres Strait Islanders of all communities who also work and live on this land that we live. So welcome to the presentation. We're going to examine the research that resulted in the paper, and in particular the early stages of where we are in the development of the outcome measure. So, as I said, this is a introduction to the Personalised Inclusive Outcome Measure, or PIEOM, and it's a tool that measures employment outcomes for people with disability by examining the various factors that contribute to employment success to measure the impact on the individuals. And the driver behind this, we've been working on this for a number of years now, but the driver has been, if you look at all the current measures that we have around employment, particularly in our disability employment systems in Australia, what we're really measuring is the processes. How well providers comply with their policy and regulations that allow them to deliver services and generate income, which in turn allows them to continue to develop and deliver services. So the individual has always been missing. Yes, we've always had quality of life measures, which are very broad in a sense, but not really specifically focusing on employment. And this is the key if you consider that the employment rates for people with disability have been largely unchanged for decades. If you go back 40 years to when the disability service standards came in, the Disability Service Act, etc., as a result of the New Directions report, obviously, nothing's changed. The employment rate has sat around about 50 odd percent. The employment rate for non-disabled people is always in that 80 odd percent range. So there's always been this discrepancy, and this is not simply unique to Australia. It's fairly common globally. If you look at the employment rates over the last couple of decades across different economies around the world, you'll see exactly the same thing. Largely unchanged employment rates, and that's points to the fact that something's missing here. And there's this old adage about what gets measured gets done. So starting from the process of, okay, how do we reimagine measuring outcomes? How do we shift the focus to the individual? And if we shift the focus to the individual and towards what we would call quality outcomes, rather than simply any job, because one of the measures that you see in employment for people with disability in general is that within 2 years of starting some type of open employment, number of people that are still in employment after 2 years, if you have a disability, is actually less than 7%. It's actually, I think it's a lot lower than that. But irrespective of that, if you look at the current system in Australia where the success rate is running at about 30%, and if you think that in 2 years' time, 75% of the people that went into employment will not be in employment, that tells you that we're not doing it right. Yes, we're having individual successes, and let's acknowledge the fact that there are people that have been in employment for long periods of time and their employment has been quite successful for them. But for the bulk of people, it's not working. And this is why if you look at disability enterprises, for instance, the number of people that transition out of disability enterprises with the skills needed to successfully engage in open employment is less than 1%. So in our various forms of or attempts at generating employment, we haven't done a very good job at it. And this is one of the drivers behind the development of the outcome measure. Now, when we start looking at the particular measure, we looked at it from the point of view of, okay, what's our starting point? What theory? What are we going to base this on? And we landed on social quality theory, and social quality theory has its origins in Europe, and it's it was conceived as a pushback to what we would call the neoliberal policy of everything has a dollar value and nothing is more important than dollar value. So in Europe they started to go, okay, we need to look at policy from a perspective of what is it doing for people. So that in a sense it's a way of balancing the extremes of neoliberal philosophy, which are the primary drivers of policy for the last 30 or 40 years across most Western economies. So when we looked at it, we settled on four domains. Now, within social quality theory, it, it resides with the four domains there are social inclusion, social cohesion, social economic security, and the fourth one was social empowerment. Now, we settle on self-determination, which is a better indicator of empowerment, I'll explain that as we go along. But the intent of this is to illustrate the impact of employment on the individual by shifting from any job to one that's meaningful and supports a career and employment outcomes. In other words, everyone with a disability should have the same opportunities that everybody without a disability. Now, everyone is entitled to have the opportunity to pursue employment that's individually meaningful to them. And I guess for adherents of social valorization theory, they're probably tickle pink with that because, at the end of the day, we talk about meaningful employment. In employment, really, there's no such thing as employment that isn't meaningful. It's who it's meaningful for and what that meaning is for someone. And we all try to find employment that's meaningful to us, that gets us excited. In other words, it gets us out of bed. We want to go there and do the job, rain, hail, or shine. And everybody should have that opportunity in their life to have employment like that. So it's important to recognize that, as I've said here, and I'm rehashing a little bit, but we've spent billions of dollars on disability employment systems since the mid '80s, and we haven't changed anything. So I mean, I think who was it? Was it Einstein that said the definition of stupidity is just doing the same thing over and over again and expecting a different outcome? Well, that's great if that's what your thing is, but it's not my thing. At the end of the day, we need to change outcomes and we need to stop wasting money and invest it properly where the outcomes will be meaningful to the individual. And I think if we can change the system so that it focuses on the individual and employment that's meaningful to them, by default, we will shift the system and its practice and hopefully its policies to one where it focuses on the individual and the quality of the outcome rather than just any job. If you look at it, and as again, I'm sort of rehashing to a degree, but as I've said there, you can see that they define social quality in the early part of the century as the extent to which people can participate in social, economic, cultural life and the development of the communities under conditions that enhance their well-being and individual potential, which in turn enables them to influence the conditions of their existence. In other words, I get a say in how I live. And you think about most disability practices in this country, they're very paternalistic, not just Australia, but globally. It's very paternalistic. It's that I know what's better for you thing. You know what? At some point, we have to stop being a parent to everybody with a disability and start being a partner with them. And that's what social quality is all about. And that's what this measure is about. Changing it from we know what's best for you to no, you know what's best for you. How do we come with you and help facilitate that so that you get what you want? And that's meaningful employment. Now, we're very lucky in this country. Paul Ward, who's one of the, I guess you'd call the second wave of people behind social quality theory, is a professor from Manchester. I think Paul's from Manchester, but he's certainly from the UK. Paul is a professor at Flinders University, and he's leading the charge, I guess, in Australia, and certainly one of the people globally that are working on this. And if you want to actually dig deeper into social quality theory, spend a bit of time with Paul. He'll probably get annoyed that I've told you all to go and talk to him, but you know what? Paul knows it, and he knows it well. So let's have a look a little bit more at the domains, which I think is important. So the domains, it says, you can see there, they are socio-economic security, social cohesion, social inclusion, and social empowerment. And I'm sorry if it looks like I'm looking down all the time. It's just that I'm recording this on an iMac, so the camera's at the top, so it tends to sort of get the top of my head. My apologies. And if you look at the domains, which are sitting there on the left there, you'll see that by and large the domains are indicators of more of, I guess you would call institutions, in the bigger picture stuff. And that's great, because that's what policy is all about. It's all about the bigger picture first, the institutions, and then potentially the individual. And we're talking about using that as the evidence base to start to develop a personal outcome measure. So what we looked at, and if you look at social empowerment, which I think is the key one here, from our perspective, but it talks about knowledge base, labour markets, openness and supportiveness of institutions, and personal relations. So if you start to look at that, these are almost quasi-institutional settings, whereas self-determination is more of a personal measure of the capacity around that social empowerment. In other words, self-determination, from my perspective, and certainly from the evidence perspective, is that capacity to make decisions for yourself and act on those, act as a volitional agent for change. And that's underpinned by causal agency theory, which is worth having a look at, and that'll give you some ideas and background behind, where we're going with self-determination. So, as it says there, there's the definition from Lynn and Herman, where it says the indicators cannot be employed as measurement instruments in the strict sense, but to develop a complex and integrated assessments with reference to the indicators, profiles, and judgments. And that should be the kernel of any assessment. So you can see that the people, the theoretical people behind social quality theory are saying, okay, here is the theory, here are the domains, now go and use this as a reference point to develop indicators. And certainly what we've done, you can see, is we've taken that and gone, great, let's build on this and build this down to, well, I guess what we call the micro or the individual level. And that's what you're seeing here in these domains. So we had to go through and define the domains. And I think this is one of the important things when I was doing the research in 2019 in New York at Cornell. What I found was that the definition of social, for instance, is almost non-existent. The social itself has lost its definition over the last few years. So when you start to think about domains and putting definitions, they need to be contextualized to what you're doing. So most of the early research that I've done at this point is around defining the domains. And of course, the next step will be then to start to look at what are the factors within those domains. And I'm going to start that work very shortly. And I'm going to do that by talking to individuals, families and individuals, to find out from them what would markers of social inclusion, cohesion, self-determination look like for them. And that'll be the starting point. So let's come back to the definition. So if you look at social inclusion, it says research in the field has focused on activities that are inclusive. And often I've heard people say, when I say what is social inclusion, and I'm amazed the number of people say to me, well, we know what exclusion looks like, so inclusion is the opposite of that. That's rubbish. It's not the opposite. It's something completely different, and that's a longer piece of work, which I'd love to discuss, but won't do it here. But inclusion must be the product of a capacity to exercise choice and control, which programs such as the NDIS promoters to admit. One of the interesting things that I find about inclusion is that people talk about inclusion as though you must be out there in society with everybody, and that's that activities thing. But the thing about inclusion, and in particular if you reference it to self-determination, inclusion will look different for every single person. You know, inclusion doesn't mean that you have to go out and be a part of something every day. You can, in my view, and this is the definition we've arrived at, so let me explain that first and then I'll come back. So the definition we arrived at was the capacity of the individual to self-actualize, and in doing so, exercise choice and control over the manner that they lead an ordinary life in the community, whether through active participation or not, as they so choose. In other words, you choose how much inclusion you want. You choose what that looks like. Some people are very happy to potter around and only go out in society and interact when they want on the terms that they want. Other people have to be out there all the time. And that's great because you know what? That's choice and control. So our definition resides in that self-determination, that choice and control, where you get to choose how much inclusion and that you want. So we even move on to cohesion, and cohesion is a really interesting one. Cohesion, Van der Mason and Beck, they define it as the extent to which social relations based on identities, values, and norms are shared. So when we look at that, we settle on the definition of the capacity of the self-actualized to develop relationships of mutuality and reciprocity that support access to community institutions that alleviate social economic exclusion and create conditions that support the individual's economic participation in society. Now remember, this is a measure of employment, all right? So you need to contextualize the definition to that particular thing. So if you think about self-actualize, that's me acting with volition, exercising choice and control, and developing relationships that are beneficial to me, that give me what I need from society. In other words, access to health, welfare, whatever you need to have the life that you want. Right? So I think that's important. This is what, in many ways, the DES system is about. If you fall out of employment, you have a disability, you can access the disability employment system to relieve your economic exclusion. And economic is often based on, I'd love a job to generate income to allow me to exercise choice and control. So that's where that definition resides. That's what's sitting in the background of that. So then we go on and we looked at the definition of socioeconomic security, and Paul Ward and his group defined it as the extent to which individual people or groups of people have access to and the utilisation of successful outcomes related to various resources. In other words, housing, finance, health, employment, education, throughout and over time. So the definition that we've settled on based on the evidence was having secure employment that pays sufficient income that a person can afford to live a lifestyle that secures access to resources that are available to all citizens and access to welfare that supports successful employment transitions throughout the life course. In other words, do I have access to welfare benefits if I'm unemployed? And do I have access to supports that allow me to move back into employment and secure employment throughout the life course? So, and you need to look at this. Employment is a life course journey. And through that life, you may be unemployed, you may be employed, and you'll go through cycles, and various people experience that differently. But socioeconomic security means I have access to resources, whether it be welfare and income, that allow me to have the lifestyle that I want. And that means, it doesn't mean everybody's going to be a millionaire, everybody's going to have a private jet and all that sort of nonsense. But it's a happy lifestyle with sufficient income that makes you feel comfortable and safe. That's where the word security comes from. We all know that when we have a reasonable income and some money in the bank, we feel comfortable and secure. And without that, we tend to be highly stressed. It's probably what you're seeing in society now with interest rates and housing. So that was the definition we settled on for socioeconomic security. And of course, we get to the final one, which is self-determination. Now, they define social empowerment as the extent to which the personal capabilities of individual people and their ability to act is enhanced by social relations. So, which is great. But what we settled on was self-determination, which is more closer to the individual. And we settled on the definition of the development of the capacity to act as a causal agent with volition and autonomy in exercising choice and control in the pursuit of career and work choices. In other words, it's my career and my job, and we should be working towards what I want, not any job that you found on the internet, right? And as part of that process, you should be helping develop my capacity to act for myself, to exercise choice and control. So we think that's a better definition. So when you start to think about these things, where are we at? And I mentioned before, we're going to develop a questionnaire to survey people to understand what they think the four domains would look like, or rather success, and that'll guide the development of the actual outcome measure itself, along with supporting the systems design research that's being undertaken in parallel. And what does that mean? Well, we're doing other research as well, because for us this is part of a bigger picture, and I've got a slide that talks about that as well. So as I mentioned earlier, what I'm doing at the moment is I'm about to start talking initially to our work first employment clients and families to find out what the success elements would look like for them across the domains. And that'll give us the guide to a bigger survey, which will then start to inform the development of the questions itself. So that's the next steps. Now, future implications, well, employers can improve disability employment outcomes by creating inclusive workplace, offering accommodations, providing training programs, kind of all the same things that they provide to all their employees. Government needs to change policy so that it allows new practice methods that focus more on the individual rather than the system. And current policies around disability employment in mainstream services are all about the system. There's no latitude for the individual at all. If you don't conform, you pay a price for that, and that's pretty sad. However, oddly enough, when you read the current DES deed, which underpins disability employment in the mainstream services, there's nothing in there that prevents providers from using other practice methods. It's compliance which drives the current practice methods, which kind of aren't really a lot in there in terms of practice. So it's really a compliance-driven system, and that has to change. We need to change, yes. The government needs compliance to ensure people are not doing the wrong thing with government money, but at the same time, we need to shift the balance back to the individual, because that's more important. This system is about the individual. It's not about the providers. It should be about the individual. It should be about striking a balance between the two. I mentioned the bigger picture. And for us, the bigger picture is based around the individual. And you can see the outcome measure is there. We've been building our customised employment work first practice model, which can be replicated in any service provider setting. And of course, the bigger picture is the systems model of employment. In other words, I've been developing for a number of years, and this is the work that I did in my thesis, PhD thesis, where I've outlined a new systems model. And that's a bigger piece of work, and I'm hoping that in 2024, that's next year, to actually start digging deeper into that and get some research going to develop a bigger system. So everything we're doing is about building an ecosystem that delivers a better disability employment service, a system, everything that's focused on the individual and the person. So thank you for listening to that. This is a recorded version of the presentation, so this is clearly runs for 25 minutes. The actual webinar itself went longer, but of course the recorded version is minus the questions in the chat. If you have any questions or you'd like to discuss any aspects of the work we do or the outcome measure itself, you can email me, you can scan the QR codes, and that will find information around CDERP and our training. And of course, you can download the PIEOM paper, which is in pre-press, by going to that web address there. So thank you. I hope I haven't been too anxious and recorded this too quickly, but you can reach out to me anytime you like, and I'm more than happy to have a conversation about any aspect of this or anything we do. It's at the centre. So thank you for your time, and yeah, let's talk.